great. All right, so to go ahead and kick off tonight, I'll introduce myself first off so you know who's presenting on tonight's topic. But my name is Laurel Winter. A little bit of background information on how I kind of arrived in this role with functional formularies. I earned my master's degree in nutrition and metabolism and completed my dietetic internship at the University of Texas Medical Branch in December of 2017. Prior to joining functional formularies, I worked as a clinical dietitian at Tier Memorial Hermann, which is in Houston, Texas. It's one of our nation's premier leading neurorehabilitation hospitals. And while I was a part of the clinical team there, I helped perform the nutrition care process with an emphasis in neurological rehabilitation. Granted, most of my patients were adults and not pediatric patients, but nevertheless, traumatic brain injury was something I saw quite frequently. So while I was in the hospital, I helped to support the development of therapeutic whole food formulary guidelines for inpatient rehabilitation. Following my time at Tier, I joined functional formularies as a territory account manager. I provide product knowledge, support, and education for providers and healthcare facilities all throughout the state of Texas. Functional formularies, if you're not familiar with who we are the creators of some blenderized formulas. Liquid Hope and Nourish are the two that we've had on the market the longest. And these are the world's first nutritionally complete, certified organic, whole food enteral formulas that are on the market today. So with that being said, tonight's topic is blenderized tube feeding. We're going to take a look at the current research that's out there supporting whole food blenderized diets and their role in patient care as well. So, flying through here. So what exactly is blenderized tube feeding? Blenderized tube feeding simply just refers to a food in a liquid that is pureed and administered through a feeding tube. So for those of us that cannot consume adequate oral intake through our mouths safely, generally a feeding tube is required to help ensure we're meeting nutritional needs in the patient. Okay, so there are several different types of blenderized tube feeding. That's an umbrella term that encompasses different types of blenderized diets. So there's the category of blended whole foods, which typically is blending whole fresh foods with some type of liquid in a powerful blender, such as a Vitamix. There's this category of blended whole foods using a conventional standard formula as a base. There's another type of blenderized diet called pureed by G-tube or gastrostomy tube, which often is done when patients or caregivers are mixing baby foods with a conventional formula and pushing that through the feeding tube. And then lastly, there is this category now of commercially prepared blenderized formulas that is now available on the marketplace for patients that require enteral nutrition. So I don't know why it keeps jumping forward. We're going to take a look at the brief history of nutritional or blenderized tube feeding as well. So when we look at the literature, there's many stories of using whole foods to deliver nutrition and foster health. It was the first method of nutritional support ever done. When we look back to ancient Egypt, around 3000 BC, they were using reeds and animal bladders to supply a mix of whey, wine, eggs, and broth to patients that couldn't eat by mouth. So, using food as a form of nutrition support is what has been done for centuries. In the 1950s, though, we saw that the development of commercial formulas came onto the marketplace. So major advances in enteral feeding techniques really helped advance the type of formulas that were on the market. And by the 1970s, we saw that commercial formulas were primarily used across all hospitals and many patients. We saw their rise due to their appealing ease of use. It was thought that commercial formulas, were safer because they decreased the risk of bacterial contamination. A lot of, hospital systems and providers liked these commercial formulas because of their precise nutrition information that was provided as well. However, there was debate in the medical community when those commercial formulas came onto the market about how they, interplayed with the patient's GI tolerance. So overall, we saw the healthcare, industry move towards providing commercial formulas as the first line. It's the status quo as well. But in the past decade, there's been really a surge in interest and requests for blenderized tube feeding for patients that require their nutrition support in this method. So the home enteral nutrition population, so this is those that are living in the home, that are not in the hospital, that are not living in long-term care or anything like that, is now over 400,000 individuals in the United States alone. The interest in blenderized tube feeding has also increased over these last couple of years. And the reemergence for this type of request has largely come from the patient or the family member. So we'll take a look here and we'll see that there's three big categories for why there's been this reemergence in blenderized tube feeding. A lot of families have a desire for this whole food-based approach when it comes to the nutrition for their loved one. There's a trend towards more natural and holistic approaches to our health and well-being. There's also an interest in the organic space as well. And also the blenderized tube feeding allows families to adapt their blenderized diet to meet food allergies or food sensitivities and or the preferred way of eating in that family. Another big reason why we've seen this reemergence of blenderized tube feeding is that there's been noted improved tolerance to formula or to the blenderized formulas versus those conventional standard formulas. There's been anecdotal and testimonial support for improved GI function, better volume tolerance with blenderized formulas, decreased retching and gagging, a common symptom that's managed with medications most times. And then also it's really been noted that patients that are on feeding tubes that receive a blenderized formula actually have increased oral intake. So they often end up taking more food by mouth, and they're often weaning off of their feeding tubes at a faster rate than those who just stay on a conventional formula. There's also psychosocial reasons as well. So having a blenderized formula helps to normalize the feeding process because you're able to provide something to your loved one that resembles something that you would sit down and eat at a family meal. It allows your loved ones to be a part of meal times and also gives the opportunity to provide and consume foods that are in line with your own nutritional values as well. So the 2015 to 2020 Dietary Guidelines for Americans emphasizes a diet that is rich in whole foods. Yet, when we look at standard formula options for those on feeding tubes, the quality of what's being provided is far below the established recommendations for healthy individuals. So what has been discussed less frequently in the world of clinical nutrition support, which is where dietitians work in complex care and the inpatient hospital setting, anyone that's on a feeding tube, usually there's a dietitian helping support that. So what's been discussed less frequently in our world of clinical nutrition are the potentially harmful ingredients in conventional standard formulas and the improved nutrient quality that comes when implementing feedings that are made from whole foods. The majority of the commercial conventional formulas on the market today are largely comprised of inexpensive and highly refined ingredients, including added sugars, heavily processed corn and soy ingredients, vegetable and seed oils, as well as casein, which comes from dairy. So it can be argued that these formulas are made to meet the macronutrient requirements. So simply like just looking at calories being provided or grams of carbohydrate being provided, but they do little to support health in the long term and potentially drive inflammation, creating dysbiosis, which it means an alteration within the GI tract, contributing to GI distress and suppressing immune function as well. So of equal importance are the benefits that whole foods can provide. So some of the most beneficial attributes of switching over to a whole foods-based type of formula are the vegetable sources of fermentable fiber that help to foster healthy gut bacteria, better glycemic control, and better digestion as well. Plant sources, or vegetables and fruits as well, contain phytonutrients, which have health promoting properties that may be protective against disease, helping to reduce inflammation and strengthen the immune system as well. So if we recognize that the ingredients in conventional formulas have been strongly implicated in the pathogenesis of chronic illness, such as cardiovascular disease and pulmonary diseases, why we wouldn't also be looking to, the formula options and what's being provided as also potentially contributing to the outcomes of these patients is something we need to be paying attention to. So there's increasing evidence that implicates that the individual dietary components can certainly impact patient outcomes. And those who receive 100% of their caloric needs via a feeding tube, it's largely been ignored in terms of the quality. Formulas may be something that you have not been approached about with your healthcare team, but it's certainly an option that's out there on the market. So I included a little snapshot here from a clinical research piece that was published out of London. But essentially, this paper highlights that the effects of artificial nutrition support they're providing calories, and it helps to support a favorable nitrogen balance, which is another way of looking at protein status in the patient. But this paper notes that their new insights necessitate that formulas are made mainly with the goal of restoring homeostasis and inflammation and immune functions, and that future enteral nutrition formulas should be made to mimic food as closely as possible. So for those of you guys that have access to a screen, and or you can look at this PowerPoint later, there's a visual graphic on the screen that shows the differences between what a blenderized type of formula looks like on the right side versus what these conventional standard formulas look like on the left. So most of the again, the conventional standard formulas are derived out of corn syrup solids and processed seed oils and milk protein concentrates. Whereas blenderized diets generally contain whole grains, legumes, vegetables, fruits, etc. So the Olly Foundation, if you guys are not familiar with the Olly Foundation, O-L-E-Y, I would look into them. They are a national nonprofit organization that has an active interest in helping educate groups of home enteral nutrition consumers. So for individuals like yourself that have a child or a loved one that requires, feeding support through a feeding tube, they're a great resource. So the Olly Foundation conducted a survey amongst its members, and 216 replied to the survey. About 60% of those were pediatric patients or caregivers of pediatric patients. So what they found in this study was that almost 90% of the pediatric population was using a blenderized tube feeding formula for an average of 71% of their total daily nutrition. So that's more than half of their daily calories was being provided in a blenderized manner. For any adults that are a part of Team Luke, that there's some information on here as well, but the adult population as well was surveyed, and they found that almost 66% of the adult population was using blenderized tube feeding for an average of 56% of their total daily nutrition. Also important to note, both the pediatric population and the adult population reported that they had greater weight loss on the commercial formula versus the blenderized tube feeding formula. So overall, this is kind of echoed in other research studies as well. There's better weight maintenance and overall less weight loss with these blenderized tube feeding formulas. So another survey was done here in 2018. This one had 433 parents surveyed of tube-fed children. What they found was about half were using commercial formula and about half were using blenderized tube feeding. The largest reasons cited from the study that the parents were using blenderized tube feeding was that they had a desire to provide whole foods to their loved one. The second reason that followed was that these parents observed that there was a decrease in their GI symptoms or tube feeding intolerance. So those were the two biggest reasons. Other reasons cited were that the family didn't like the formula provided. They wanted to provide something that was like their family meal. Certain family members, around 11%, noticed that their loved one had increased oral intake on the blenderized diet, and about 5% were using blenderized diets to address allergy concerns. So the reports from parents that were using these blended diets reported fewer symptoms. Children met their growth goals more frequently as well. But what was also really interesting about this study is that only half of the parents that replied to the survey referred to the healthcare providers for recipes and as dietitians is that there's a desire amongst people out there that require formula via a feeding tube to have blenderized formula. And that there's a lot of people that have fear in talking about this with some of their providers for concerns about pushback or that they're not going to accommodate their requests. So family members are doing these things anyways, but not talking to their doctors about it. And where I come in is I really am trying to educate these providers and also, talk to the family members about how we can bridge that gap and work to get, patients what they need. Things should be patient-centered. We should be, moving within the healthcare system in a patient-centered manner. I'm a big patient advocate, so I spend a lot of my time out there educating doctors about what it is that we do in the clinical research we're involved with. This is an adult study. I'm going to go through this one quickly because I think most of Team Luke is the pediatric population. But again, this echoes some of what we've already heard from the previous surveys. Most common reasons for blenderized use are that it's more natural, they liked eating what their family was eating, and that they observed better GI tolerance or better tolerance with their formula. 80% also reported maintaining their goal body weight. And also those patients, the 54 adults in this cross-sectional study, reported they had significantly less GI symptoms with the blenderized formula compared to a commercial formula. And then here, again, parent requests. This is a survey of pediatric dietitians that work with young kiddos on feeding tubes. But 60% of the dietitians replied to this and said that the largest reason why they were recommending a blenderized formula was because the parent requested it. So if that tells you anything, I think that the healthcare system still struggles to recommend something that is a whole food-based formula up front, and they largely wait for that family member to come in and say, I want this, or, this is something I've heard about. Can we have this, child for my daughter or my son or my, husband, whoever. So that's how really blenderized nutrition's come back into the arena, is that the parents are requesting these things. And I have to say, don't stop advocating for yourself. 23% reported that they were recommending blenderized tube feeding for their patients because they noted that there was better tolerance. So again, that's something that's been noted now across the last 3 or 4 studies. There's better GI tolerance with these blenderized formulas. Getting into a little bit more of the granular data, aside from like what's driving the increased use for these things. We have clinical studies now that are actually looking at GI measures, that are looking at the gut, and that are looking at the shifts that are occurring in the body as a result of the type of formula being provided. So this was a study that was done in 20 pediatric patients that were ages 1 to 16 years old. All were G-tube dependent, receiving 3/4 of their energy needs from a standard conventional formula. The study transitioned all of the patients over to a blenderized formula over 4 weeks, and they looked at different outcome measures. So some of these outcome measures, what they found was that the blenderized formulas compared to the commercial formula, they found that there was superior micronutrient content in the blenderized formula. They found that the bacterial diversity in the guts of those patients increased, which is a good thing. they found that the pathogenic and harmful bacteria decreased with the blenderized formula. So what we're seeing here is that the whole food-based formulas contain fiber from diverse different vegetables and legumes that helps to foster a good gut bacteria. We'll talk about this a little later on, but 70 to 80% of your immunity is within your GI tract. So what we're feeding the body can certainly manifest in more illness, or it can also help to provide a better foundation for the patient so that we're hopefully circumventing and preventing those things from happening. The study also found that vomiting decreased in patients from 76% to 53% that were on a blenderized formula. Gagging and retching, which is a really common manifestation of our tube feeding patients, decreased from 82% to 47%. A lot of our healthcare system addresses things in a more pharmacological approach. They're like, oh, you got reflux, let's throw an antacid on it. Oh, you're vomiting, let's throw a medication on you. But to really take a step back and look at, what's being provided to the patient and how that can be affecting those symptoms is something we need to be considering as well. They found that the oral intake for patients on blenderized formulas also increased from 67% to 80%. Acid suppressive agents, which are used to treat reflux, those decreased as well. Caregivers also reported that they perceived their child was in significantly less discomfort. They were more satisfied with the feeding regimen, and all would have recommended blenderized formulas to other parents as well. So this next study actually was published last summer. So this is very recent. It was published in the Journal of Pediatrics and was done at Boston Children's Hospital, which is our nation's #1 pediatric hospital in the nation. They're really spearheading things also and really championing looking at blenderized research, which is exciting. So this was a study that had 70 medically complex children, ages 1 to 18 years old. 60% of those in this study were on a homemade or commercially prepared blended diet. 40% were on a conventional standard formula. Majority of the patients in the study were fed via a G-tube. There was a smaller proportion that were fed via a GJ or a J-tube. So when you get the slides, if you're able to view right now, great, but I included a table in here that shows you the different comorbidity categories of the patients. So you can see that there was a variety of different conditions enrolled. So there was neurologic, which is where brain injury falls under. There was metabolic, there was cardiac, respiratory, etc. And you can see that across all the different types of diagnoses, there were patients that were fed via G-tube, GJ-tube, and J-tube. And you can also see how many were fed via a regular formula versus a blenderized type of formula. So what this study found actually I think is quite compelling. This was the first study that looked at healthcare related use for patients on a blenderized diet versus a conventional standard formula. They found that for patients that were on a blenderized diet, they had their total admissions into the hospital over an 18-month period were down 53%. What that means is that patients that are on blenderized diets have less healthcare use. They have less readmissions back into the hospital because overall they're having less complications. This is the kind of data that I really take to healthcare facilities where I'm really trying to advocate for hospitals to add on blenderized options onto their formulary. So healthcare data, this healthcare data is the first of its kind out there when looking at the type of formula, blenderized versus a conventional standard in healthcare use. What they also found after these participants filled out a questionnaire, there were greater satisfaction ratings for those on the blenderized diets, fewer reflux symptoms were reported, and they noted improved GI function across a number of measures. So they found that patients that were on blenderized tube feeding formulas had significantly less nausea and vomiting. They had significantly less abdominal pain and abdominal upset. There was less worrying about stooling, significantly less diarrhea, and also there was less of a limitation to food and drink, meaning that the oral intake for those patients on a blenderized diet was significantly greater. I think that goes back again to if patients' intolerance signs are being improved and they're not feeling nauseous with the feeding, or they're not about to retch and throw up, you know, they're going to be more inclined in working with speech therapy to, you know, do more oral intake, to try different foods. So that's something that even the speech therapists are catching on to, which is actually exciting because we need more healthcare providers in our system aware of these things so that we can move the healthcare system in the right direction. So I'm going to summarize this slide, but the study, the Boston Children's, outlined some potential mechanisms as why they saw this decreased healthcare use. So they noted that although the data showed similar energy content and macronutrient composition, so what that means is looking at calories provided or percentages of macronutrients, they found that they were similar between the conventional formula and the blenderized formula. However, what they noted was the quality of the macronutrient composition differed substantially. So they noted in their study that those commercial formulas had, you know, rapidly digested carbohydrate sources from corn syrup solids in like maltodextrin, whereas the blenderized tube feeding had slowly digested carbohydrates from legumes and whole grains. They also noted that having fruits and vegetables and the vitamins and minerals that come from eating those types of foods is different than the added vitamin mix that generally is added to those conventional formulas. It's not the same. So they noted too that the provision of a diet containing actual fruits and vegetables rather than simply vitamins as is present in conventional formulas may reduce the hyperreactivity of the airway, which is why we have seen in the past studies that we've looked at so far that there's an improvement in reflux, that there's a decrease in antacid use. So fiber is a really important driver within the body for helping to modulate different things. So dietary fiber can acutely decrease airway inflammation. It helps to shape the intestinal microbiome, which is the bacteria that lives in your gut. Also, the dietary diversity that's provided in a blended formula helps to increase that microbial diversity. So there's more species of those bacteria that exist in your gut, the good kind, that's associated with a decreased risk of asthma, systemic inflammation, and obesity as well. So this is kind of spearheading the way, and we're kind of on the tip of the iceberg. I think more and more research is going to keep coming out in support of this. But overall, Boston Children's noted that blenderized diets were well tolerated, they were safe, and they're a relatively low-cost intervention compared with expensive medications to improve the health outcomes in the tube feeding population with the potential for significant reductions in healthcare costs. So great study to have. We've only got a couple more, and then we're going to talk about some formula. So this study here was really recent. This was published earlier this year. So I was trying to find the most recent data for you guys. This study had 23 children that were ages 1 to 18 years old. All were fed via G-tube, and all were subsequently switched from a standard formula to a blenderized type of diet. The patients were followed over a 12-month period, and the dietitian saw them every 3 to 6 months for follow-up measures. So what they found was that 95% of the patients who were previously experiencing upper GI symptoms improved within the first 3 months after the blended diet initiated. And that was sustained through the rest of the study period, so through the rest of the year. While those patients, the same patients, were on the standard formulas, 91% of those patients had experienced symptoms. 40% reported gagging and retching, about 50% reported that they were vomiting, and there was about 5% that were reporting that their child had a cough with a concern for aspiration. So more than half of the caregivers in this study reported that there was improved oral intake as well. There was no evidence of any nutritional deficiencies in these patients. There were no hospitalizations for any suspected foodborne illness. And patients that were on the commercial blended diets tolerated them well and had an improvement in their upper GI symptoms. So there's options for you guys when it comes to looking at blended formulas. So there is certainly the area of homemade blends, right? If that makes sense for you and this is what you desire to do. So in doing a homemade blend, you've got more flexibility. You can do a blended diet based on whole foods, adding it into your blender with a liquid. As mentioned at the beginning, you can do baby foods mixed with a conventional formula as a base. There's different options. If you're doing a homemade blend though, most of what is out there in terms of research shows that most homemade blends are compatible with G-tubes of a size 14 French or greater, okay? Bolus is usually a preferred method, so that's, you know, similar to eating a meal, kind of push that bolus through versus a pump. And generally for homemade blends, it's recommended that there's a 2-hour hang time. So it's a shorter window. Now there's this option for the commercial whole food formulas. So that is manufacturers like Functional Formulators, who I work for, that make blenderized formulas that are commercially prepared and that are, you know, sterile and safe to use as well. So these commercial whole food formulas allow for wider use. So say you're traveling, right, and you need something on the go, or you're not having time to blend because you're busy and you're juggling your job. This is where prepared blenderized formulas can be a great fit. So the available options that are out there today, there are some blenderized formulas like ours that will work with smaller tube sizes. We've been shown to be compatible with J-tubes, which is a pretty narrow tube size. Our formulas as well have available nutrition information provided. So, you know, there doesn't have to be the concern of making sure that you're meeting everything. If you're doing it in your kitchen on your own, these formulas already have all the nutritional information provided on the back of the package, so that the medical providers and dietitians feel maybe a little more assured in knowing that your child or loved one's getting what it is that they need in terms of meeting their protein needs and their carbohydrate and fat, etc. The other great news is that these commercial whole food formulas that are available are often covered by insurance. So that's great news. If you're doing a homemade blend yourself, insurance is likely to not cover your groceries. It doesn't work like that. But insurance is more and more covering blenderized formulas. I live here in Texas, so I can tell you with confidence that like Texas Medicaid generally covers these with no problem. But when it comes to commercial private payers and all that, it's a little different depending on the policy. So just know that commercial whole food options, prepared options are out there on the market. So with that being said, this slide shows some of the Functional Formularies blended formulas. We are the world's first nutritionally complete certified organic whole food product on the market. So our products are 100% organic and plant-based. They're gluten-free, soy-free, corn-free. We don't use any added sugars in any form at all. The products are also sole source nutrition, meaning they contain everything that, you know, the child or adult would require in terms of meeting all of their micronutrient needs, with the exception of our new keto formula. That's the only one that is not sole source nutrition. But Nourish, what you see in the green pouch, Nourish is our pediatric centric formula. Liquid Hope is intended for an older age range, but we do have some pediatric patients that use it. I'm happy to answer questions about these too after we wrap up or off the call separately. So all of our product line as well has really favorable ratios of omega-3 to omega-6 fatty acids. The types of fats that we consume in our diet are important. It's not about not eating fat. That's an old myth. It's about getting the right types of fats. Fats are important for our cell membranes. They're important for our brain and cognitive function. So we want to have more fats in the diet that are actually healthful fats. So with traumatic brain injury or any chronic illness, controlling inflammation is paramount. Sugar-rich formulas that are devoid of fiber and contain highly processed seed oils that are high in omega-6 fatty acids promote more of an inflammatory state within the body. Focus on those omega-3 fatty acids. Their role in growth and maintenance of the neurons is well known. Also to note, I mentioned this previously, 70 to 80% of our body's immune cells are found in the gut. So dietary fiber helps to shape the intestinal microbiome composition and also affects short-chain fatty acid production. Short-chain fatty acids direct immune cell communication within the body. So, think of the food you eat as chemical messengers to the rest of the body to, carry out and execute certain functions. Phytonutrient diversity is also really important. So eating colorful, different food, vegetables and fruits. Phytonutrients are really important for helping to enhance immunity, for intercellular communication, helping to repair damaged DNA, and also they're involved in detox pathways as well. Something that is kind of increased area right now is the ketones. Ketones have been shown to be mitochondria protective. So your mitochondria are the energy powerhouses of your body. So ketones have been shown to be mitochondria protective, directly and indirectly decreasing cellular oxidative stress. There is a type of ketone, if you guys are in the circles of, talking about brain injury, you maybe have heard of BHB or beta hydroxybutyrate, which has been shown in research to help suppress the inflammatory response as well as increase brain-derived neurotropic factors that may help initiate long-term repair as well. So there's options out there for you guys. I hope this was informative. I know it's a lot of information to digest, so if y'all have any questions or anything, don't hesitate to reach out. We'll turn on the mics here in a second to answer any questions. I've linked some resources to the slides as well. The Olly Foundation I mentioned is a national nonprofit for home enteral nutrition consumers. There's also Feeding Tube Awareness Foundation as well. I included a link to the homemade blended formula handbook. If you're interested in, doing your own blending at home, that is a handbook that can be purchased on Amazon. And then Functional Formularies, the company that I work for, we have a FAQ nutritional page that has all sorts of links and questions relating to nutrition. I encourage you guys to peruse that and read through it in your own time. But there's many resources out there for families that have tube-fed individuals that they're caring for. So harness those resources and be an advocate for yourself. Don't be afraid to, advocate. I think it's really important. And with that being said, I'll open this up for questions. I'm available if you guys are interested to get samples of our products. We can talk about that as well. I've included my email address on the slide.
Since there's just a few of us, y'all don't feel like you need to type in the question. You can just ask it. It's all good.
Yeah, I don't have any questions. I've been really interested in this when I saw an ad for the Real Foods Blenderized Tube Feeding. But I like the idea of all the vitamins and not all the corn syrup and sugars that's in the Pediasure. Mm-hmm. Having her eat like basically what we eat. She used to eat it by mouth, like I would just puree her food and feed it to her by mouth. But since her surgery last year, she kind of stopped taking things by mouth. Mm-hmm. And so we just went to like really just tube feedings. Mm-hmm. And it's just been formula based. And that to me, I'd rather it be more natural.
Yes, definitely.
Yeah.
Yeah. I hear you. And, you know, when I was working in the hospital, working with, you know, families and patients, when a family confronted me as the dietitian about, why are you putting this in there, my child, you know, my loved one's feeding tube? Like, you're the dietitian. What do you think about this? You know, I had a hard time reconciling that, like, what I had to provide based on the hospital contracts was just that, you know. In the outpatient world, though, when you guys are like, you know, you're getting your supplies provided through your DME, there's a lot more flexibility to make those orders, to get you changed over to a blenderized type of diet. And so most definitely, like, a growing child needs more than corn syrup. They need more than just milk protein concentrate. You know, it's really, sadly, it's the area where I think dietitians can really make a change right now. And I think we're seeing that's occurring. So, of course, you're going to need to talk with your healthcare team about what's going to be the best option. But now that you're armed with more information, and also I'll tell patients, take research with you, because sometimes, you know, a provider might tell you, they don't know anything about it. Maybe that might be the case. They maybe are not aware of the research that's out there in support of it. But I would hope, you know, Jennifer, I know you're in San Antonio. I know of some clinics that are comprehensive care clinics that are readily using blenderized diets. So I'm happy to also help share what contacts and resources I have within San Antonio, since I'm familiar with the area.
That would be awesome.
Sure thing. And Jennifer, if you want to, before we go to the next question, my email is in this slide deck. It's on the last slide. So if you'll reach out to me, you can just email me. I can that way correspond with you about who some of those providers are.
Okay, perfect.
Great.
Thank you.
No problem. All right. Any other questions?
Yes, I have a question. This is Liz from Illinois. Actually, a statement and a question. So my daughter we're almost at 3 years from her accident. She choked on a grape almost 3 years ago. So now she does take some purees by mouth a little bit. Like I do like some baby food purees. But she's mostly just tube fed. And we actually switched to Nourish. Probably she's been on it probably about 1.5 years. So when you were talking and saying about, like they don't mention it, it's so true, because I learned about it from like other Facebook groups, other different support groups. And so when I asked my doctor about it, a nutritionist with her pediatrician, at first, they were trying to push me towards a different way. And I'm like, no, I want to try Nourish because I heard that it was, really good. And she did. She used to vomit every single day, multiple times a day, and she doesn't anymore. She hasn't vomited in, I don't even know how long. It's been like probably close to 1 year that she's vomited. Now she, like, her tummy's fine. She uses the bathroom regularly by herself now, like no, before she had a problem. So it's changed. It's definitely changed her. And, I thank you guys for coming out with the formula like that, because it's really been so helpful. So I think my question is, I would like to start like, blenderized feedings as far as like homemade. Mm-hmm. I just don't know how to start and where to go about starting it, because they have her on a strict calorie because they don't want her gaining too much weight, because before her accident, she was already like a chunky girl. And so she's about to be 6, but she's 80 pounds and over 4 feet tall. So I think my thing is, I'm just scared of like overfeeding her. If I were to do it on my own, I wouldn't know like how to start, what exactly she needs, Right. I'm just like scared of the process.
Right. Well, first off, thank you for sharing your experiences and what it's been like for you guys through your journey. I appreciate that. And it's always validating to know, hearing from patients and hearing from family members that they've had great success is very gratifying at the end of the day. I mean, I think that in medicine, we should all be doing, well, the first principle of medicine is to do no harm to the patient, right? So really, in looking at the whole patient, treating them in that way and providing nutrition, right, through what we know to be true based on years of scientific data, which is, time and time again, like eating produce, choosing fiber-rich foods, eating whole grains, etc. It's I think the industry, it's a lot of politics. There's a lot of politics involved, even in healthcare, from the top down. So a lot of the system, when I say the systems, that maybe not even aware of it as an option, right? Or they're just trained based on their training to go to that pediatrician as the first thing, But communities talk, like you said, you get a part of these groups. After you go through something unthinkable, right, and you have a loved one in your family that has a traumatic brain injury, it really changes things. And that's where, like I said, my eyes opened up, and I couldn't not advocate for people like you, your loved ones. I just couldn't. So anyway, I'm thankful to hear that, and I'm glad she's doing really well. So great news. When it comes to looking to do things on your own, things can get tricky. I certainly can understand that it's nerve-wracking because there's more variability, right? And there's concerns, if you're doing your own blends, there's a lot that has to be considered in terms of the viscosity of what you're blending, right? Like you don't want to blend things that are going to cause clogs in the feeding tube. You don't want to add things in there that, you might have to strain the formula. There's just certain nuances if you do it yourself. My advice would be, if you guys do you have a dietitian in Illinois where you're at that you work with readily?
Yes. Mm-hmm.
Okay. At your next visit, you may ask, just say, hey, I would like to consider, being able to introduce some foods on my own time. Maybe that dietitian could help walk you through it, because it really does require oversight by a medical professional. To ensure, if you're decreasing the amount of nourish, and you're increasing whatever own foods you want to do on your own, we're going to have, they're going to have to make sure that you're, meeting all the macro and micronutrient needs. So that the formula handbook that I linked the slides, which will be sent out, that might be a great starting place. If you order that and look through it. I have no ties to it, but I have heard other people out there have used it as a tool. And then for some, I have heard of family members that will use, like, they'll keep using Nourish, like you're saying, she's on it, but maybe they're just like, they're still going to use Nourish as a base and then like increase, change things in and out of the regimen based on, whatever it is that you guys might be eating. Right.
Yeah, I think it's like, she was such a good eater before her accident, right? Like, I just feel like she's been on the same thing for 1.5 years now. Like, poor baby, like, how long can they be on the same exact thing? Like, how long? I don't even know. Is it okay for, a kid or a person to be on the same exact formula for like the rest of their life? I mean, I don't know how that goes. Like, I just feel more bad because I'm just giving her the same thing versus to have like a variety,
Sure. Sure. Right. Yeah, no, I totally get that. And maybe where you're doing some of those purees by mouth, like there's an opportunity to try, and I don't know how much, your child's taking orally, but that would be an area or a time in which you could trial new foods, that are not within Nourish, that way to increase the diversity of, different foods that she could have. But I mean, I can tell you with confidence that any, the Blenderized formulas are going to be I don't even know what the longest length of study is looking at an enteral patient. It's probably not that long. I would probably hedge to bet like 1.5 years to 2 years, because funding generally runs out. But yeah, I mean, to consider what the long term might be for a patient that's on a formula is something to consider. I will make mention that Baylor College of Medicine is here in Texas. They're based out of Houston. And some of their doctors reached out to us interested in doing an interventional trial because they noticed that patients that were long-term tube feeders, so think of like a cerebral palsy patient or someone that's been on tube feeding from a very young age that was going into adolescence and like into their teenage years, they were finding that these patients that were on a conventional standard formula for that long, they were developing fatty liver disease, right? So non-alcoholic fatty liver disease, they were beginning to notice that there were fatty liver deposits in these kids that had never eaten anything by mouth and that had only been fed via a conventional formula made up of like sugar. So, you know, there are implications, I think, of using those conventional formulas for the long term, most certainly. With the blenderized diets, I think there's a lot more flexibility in being able to adapt, you know, the recipes and try different things. But I would look up those resources linked to the to the slide deck, and I would also highly, highly encourage you to talk to your medical team about it too.
Okay. Yeah, that's what I do. And I'm sorry, I just want to make one more comment. I know you had mentioned that, you know, a lot of times they won't carry, like the Nourish in like the hospital settings. But what I learned, and I used to always bring her Nourish because in the beginning it was like that, right? Like they try to give her something else while she was inpatient because they didn't carry it. Mm-hmm. And they would always, even to this day, like they still tell me they don't have it. But then once and I always carry it just in case. But I found out that once the nutritionist came into the room to like check on her, and I would mention that, you know, they would ask what formula and I'd mention it, they always had some samples. And they told me always ask for the nutritionist because they don't know what we have. You know, the people that work on the floor, they don't know what they have like in their offices. So they would, you know, bring some up every, you know, day that we were there. But I always always ask for the nutritionist because a lot of times they have these other ones that they're not necessarily on the floor, but they do have them there available. So I just wanted to share that with maybe some of the other parents that didn't know that.
Thank you. Yes, that is definitely the case. Hospitals will often have formula samples of other things they don't have contracted on formulary. The good news is we're making headway in getting on formularies at a lot of children's hospitals. So that's changing across the nation, and every day there's more and more people exploring that, more hospitals that are exploring that as an option. But what I'm finding though, when I talk to the dietitians, is that they'll be like, yeah, we have it contracted, so we can provide it, but we'll only provide it if the patient's already on it. Which is like, you know, it's probably the pressure, you know, of the healthcare system to say, hey, the Pediasure option, just as an example, is cheap, right? So we want you to use that. But they have other options out there, but they want to see some issue develop first, like an intolerance, like the diarrhea or the vomiting, before they'll look to provide, you know, a higher quality product. It's unfortunate, but that's kind of the way the healthcare system is at this point. So depends. Certain academic hospitals are different and they're very progressive in doing things differently, like Boston Children's and Cincy Children's and Children's Hospital of Philadelphia. I see it changing, but we'll keep fighting. I think we'll see in 10, 15 years, we'll look back, and I would hope that every hospital has a blenderized formula available.
Right. Mm-hmm.
Nancy, or I can't see the last name here. Why is it not jumping out? Elodia, do y'all have any questions? Great. All right. Thanks, Nancy. I'm glad you were able to join. There's another Nourish user, 2 of you guys. I'm glad. So thank you guys so much for joining.